Hi, I'm Helen Harvey. Welcome to ATUNE. It's just so great to have you here as a part of our team. So today we're going to just tell you a bit about what the Naturopathy department does so you can understand how we're helping all our clients.
Hi, I'm Amanda. I'm also here in the Naturopathy department. Great to have you here, and we're going to explore some of the conditions that we do and we don't treat, and just give you a bit more of an insight into what naturopathy does.
So what is naturopathy? Naturopathy is built on the basis of the body's own innate healing abilities and understanding what it is that gets in the way of healing for somebody and providing tools to help them overcome those blocks so their body just naturally does what it needs to do to heal. So what tools do we use to achieve that? Well, diet is fundamental, providing the building blocks for healing. But we also have our wonderful herbal medicines, which are just such beautiful medicines that work in harmony with the body to restore health. We also look at the whole health of a person in the context of their social, their emotional, their spiritual well-being. And even things like exercise and lifestyle influences are very important to the whole health picture of somebody.
So I'm just going to go through some of the things that we do and we don't treat. For example, any acute emergency conditions, please don't come to a naturopath. Consider just going to the hospital or the GP. So some of the more common conditions that we treat are things like gut issues, so irritable bowel syndrome. People often say, I haven't felt well since I went on this holiday somewhere. I've had nausea, I've had bowel issues. So whether it's irritable bowel, Crohn's, inflammatory, any sort of inflammatory bowel disease, peptic ulcer, reflux, they're the sort of areas that we treat. Of course, with, as Helen mentioned, with our herbs, with nutrients and with specific diets. I'll just go through some of the other systems that we see and the conditions. So in terms of liver, gallbladder issues, we see a lot of non-alcoholic fatty liver disease issues, people wanting to come to us for a liver detox. That's really, really common. So we'll put them on a program of liver detox, say whether it's 12 weeks or six weeks. Gallstones are really common. It's not that we specifically treat it, but we can help to, say, reduce the progression of the gallstones, help them to dissolve the gallstones over time. We don't do anything acutely for that, but it's really giving them herbs and dietary recommendations to help reduce their cholesterol, for example. We also cover autoimmune conditions. And this is by regulating the immune system, not just by stimulating or suppressing it necessarily. Typically in these autoimmune conditions we might see things like lupus, like thyroid issues, Hashimoto's is really common. I see quite a lot of cancer patients, so I work with an oncologist and offer support during a patient's chemotherapy and radiotherapy treatment. In terms of respiratory conditions, we also see a lot of chronic sinusitis. We see a lot of allergies, whether it's hay fever or recurrent infections is also really common. Asthma, bronchitis, COPD. We cover a lot of dietary, herbal, lifestyle recommendations for these. In terms of musculoskeletal, we will commonly see clients with rheumatoid arthritis, osteoarthritis. Gout is also really common. Skin conditions, so psoriasis, eczema, dermatitis is also very common that we see, even urticaria, so people that break out in hives, they don't know why. They've been to their doctor, they've tried some treatment, but it hasn't quite brought it down completely, or they've had them again and again and they just don't know where they're coming from, what they're from. So we try and do some investigations there, whether it's food-related, chemicals, environmental, etc. We also help with urinary tract infections, bedwetting in children. I'll go into detail a bit more about children later. Female reproductive issues, menstruation issues is a really big one. So PMS, menopause, endometriosis, PCOS, infertility, they're massive issues that we also can help with. male repro as well, whether it's benign prostate hyperplasia, erectile dysfunction, andropause. They're all conditions that also can be helped with naturopathy. In terms of cardiovascular support, we see a lot of patients with hypertension, cardiovascular disease, high cholesterol, and so we give a lot of dietary recommendations as well, but again, we also use a lot of our herbs and nutrients in those cases. We also get patients with diabetes. So, for example, with diabetes, we're not there to interfere with what the doctor's doing with their insulin, for example, but we're here to support their blood sugar imbalances, offer them support for weight loss, dietary recommendations, putting them on a low glycemic diet. The herbs that we give would help to balance out their blood sugar levels as well, but they would need to be monitored while they're on those herbs. And this would help, for example, to reduce their dose of insulin. So it doesn't mean that they come off it necessarily, but it may mean that it can help reduce some of the dosages of that. Obesity and weight loss is a big one as well that people often come to us for. So again, that's something that's chronic. It's not a quick fix. There's no quick pill or quick herbs for that, but that's a real process where we walk side by side with them and help them gradually. We look at the underlying issues of obesity or the difficulty in losing weight. We look at inflammation as an issue of infections, hormones, stress, insulin resistance. They're all really big issues involved with weight loss. We also do a lot with insomnia, sleep disorders, mood conditions such as depression and anxiety. That's really common with naturopathy because a lot of clients are on antidepressants, but either they've reacted to the antidepressants or they're weaning off them, or they don't, they just don't want to be on them anymore. There are things that we can do to help, again, the patient to reduce inflammation in the brain, rebalance the neurotransmitters, help with gut function, because there is that gut-brain axis that's very much linked with mental conditions. I've already mentioned fertility. Helen will talk about pregnancy, breastfeeding. They're all issues that we can help along with, and that's the whole life cycle. So first, second, third trimester, coming into labour, and then breastfeeding. That's all a part of a naturopathic support. And then with kids, we deal a lot with kids as well, whether it's young babies who are teething or they have colic, nappy rash, cradle caps, support during post-immunisations. That's another area that we cover. Recurrent chronic infections, autism spectrum disorders, ADHD, food allergies, diarrhea, constipation. We deal a lot with kids. We both have kids of our own, so we love dealing with kids, and they're not that difficult to treat. Another thing that I wanted to mention is that we also help to organise functional pathology testing. So this might include things like a stool test, and they're a little bit different to what the doctor would do. These would include good bacteria as well as any bad bacteria. They include yeasts, and when we look at parasites, we're looking at how strong the parasite is there, whether it's active or non-active, for example. We look at hair. We use hair mineral analysis to look for toxicities with heavy metals. We use food intolerance tests. We use salivary hormone testing for male, female hormones, as well as the cortisol response. We look at liver detoxification profiles, and also MTHFR, which is a big one that reception will often come across. But yes, that's an area that we can also deal with, and people will often ring up about that. So please don't be afraid to ask us any questions. If in doubt, just come across to us or send us an email. We're more than happy to go into more detail about any of these conditions or any additional ones or treatment. Thanks a lot.
Thanks, Amanda. That's a great rundown of the huge variety of things we do, and I think from that you can see that there's really not much that we can't help people with. 1 in 5 people have a chronic disease these days, and often it's a multiple chronic condition, so people are really wanting help with their health. We're quite happy to work alongside doctors, people's medical team, and communicate with them so that people get the best of both worlds. And I think that's what helps to bring people back to health. I'm particularly passionate about working with mothers. The health of the unborn child is a big one for me. So to do that preconception care for both the mother and the father can just have a really big impact on the health of that child. Supporting mums through pregnancy, and that postnatal period is really important too, where mother and baby just need a lot of nurturing. I really love working with hormonal disorders, autoimmune disorders. Stress and mental health is something that's really important, and I think that naturopathy has a lot to offer. So if your clients are asking, can naturopathy help with a certain condition, I think the answer is always yes. We have something to offer.
I like to see myself as more of a general practitioner, helping in any sort of areas. I don't really want to narrow myself down to a particular area, but I really enjoy what I do, and I enjoy offering not just the herbs and the nutrients, but also dietary and lifestyle support. There's so many things we can do. And
as a naturopath too, I see our role as teacher. To participate in naturopathic care is about empowering people to make changes. There's the small changes that can have a big impact on their health. Yeah. So our role is very much as teacher to help them see the negative influences on their health and the positive things they can do to support themselves. So it's not a passive thing to be in naturopathic care. You really need to get involved with supporting your own health.
So can you tell us, guys, so what testing do you guys actually do when it comes to your treatments?
Okay, so naturopathic testing can be a little bit different from medical testing, although we're always really happy to have a copy of your blood tests that your doctors have done, or any other pathology reports or reports on imaging, because we are quite skilled at looking at those standard pathology things and interpreting them for you, and that really helps us to get a more complete picture of your health and the investigations that have already been done. But we can add to that more naturopathic functional testing, things like stool analysis, which looks at more or less the function of your digestive system. So there's a lot of markers there that tell how different parts of your digestion are working, but also a lot of information about your microbiome, so the gut bugs that are living there and really impact your health. We can also do hair analysis to look at heavy metals and toxicities in your environment. What have I missed, Amanda?
Salivary hormones.
Yep, that's a good one.
So male, female, as well as stress hormones. MTHFR, a lot of people ask us about.
So that one's a genetic test that's very topical at the moment. A lot of people are investing in it, and that can be quite powerful in doing things like mood imbalances, people with a strong family history of cancers or cardiovascular disease. That gene can really play into conditions like that.
What we don't do are things like live blood analysis. That's not a part of our consultation.
You might get questions about that one because a lot of naturopaths do live blood analysis, but it's one that Amanda and I don't do.
Yeah. We also offer iridology, so
that's a nice one.
We have now a specialised camera for iridology that will take a detailed photo of a client's both irids, and this we can put onto our laptops, so we can really go into a lot more detail about a client's constitution, and then go into a little bit more detail about which sort of body systems may be affected, whether they're inflamed or whether they're a little bit weak. It's not something that we would use solely for diagnosis. It just helps to confirm some of their conditions that they have.
So guys, what does a normal naturopathic consult and follow-on treatment look like?
So when you first come in to see a naturopath, your first appointment is usually a long appointment. It's an hour long. That gives us enough time to take a very detailed health history. We also look at your diet, so we will ask you what kind of food you're eating. But we in that appointment we get a bit of a timeline too, to try and understand the development of your unwellness and where it's come from and all the impacts, not just the presenting condition. Sometimes we will give you the client a prescription in the first consultation, but depending on the complexity of the case, there's often a lot of drugs and herb-drug interactions that we need to look at before prescribing. But we're also we're looking at the condition that they're presenting with, but also improving what we call the terrain. So improving the underlying health and resilience of the person, so that they can overcome the condition that is bothering them at the time.
So what we might also do is go through their diet diary, for example, have a look at what they're eating at breakfast, lunch and dinner, snacks, their hydration as well. We will do a bit of a clinical exam, so might take their blood pressure, their heart rate, look at their height, their weight, BMI, body temperature perhaps, include a quick iridology assessment. This might be a really quick one at low magnification.
Fingernail signs.
Yes, fingernails,
tongue signs.
Yep, and general skin, like and ask whether they've got any skin sort of rashes as well, or little bumps that might not have otherwise come up in the consultation. And then
so that first appointment is really very much an information gathering exercise, because often there's a long story behind people's health conditions, and it's always very important to getting them well is to understand what it was that got them to that point, to get them in front of us.
And we might offer some just general principles of health for them. So it might just be switching some of their foods around initially, but we're not doing too much because we don't want to overwhelm them, but we're just giving them some general guidelines initially.
So most patients will go home with a nutritional prescription, so that is nutritional supplements just to push the body in the direction of healing, and very often there's a herbal prescription as well. So herbal medicine can be dispensed in our lovely brown bottles of beautiful tasting herbs, or if taste is an issue, we can often find a tableted formula.
And when we put a herbal mix together, we do consider all the different actions of herbs. Herbs are quite different to like a pill that you'd get from the doctor, because one herb will have lots and lots of different actions, whether it's 10 or 20. So for example, whether it's anti-inflammatory actions, antioxidant, reducing blood pressure, lowering blood sugar. There are a lot of different things that herbs can do. So we try and choose the herbs that are most relevant for that individual, and then we put together those herbs in a bottle for them.
So that's a lovely personalised prescription for that person.
And then say in 2 or 4 weeks, we'll ask them to come again if needed, usually do, and then we would go into more detail about their condition and how they've gone with their herbs or their nutrients, what further testing we may need to do, and follow them through. So sometimes, we're looking at least 6 weeks to 3 months of treatment, because we don't treat acute conditions. Well, unless it's like a cold or flu, yes, then we can give them a quick sort of immune remedy for that, and some really good quality vitamin C, some zinc, probiotics, for example. That might be a case where we do treat acutely, but most conditions, we're really looking at 6 weeks to 3 months. For more complicated cases, it might be a year or 2 years follow-up. They need to come and see us maybe every 4 to 6 weeks, so that we can really check in on them and see that they're improving, that they're compliant with whatever we've given them.
Implementing the changes, because sometimes when you're asking somebody to change their diet, it takes time to change the habits of the way you eat.
Definitely. Yes. And lifestyle. So getting people to exercise regularly is also a big one. Getting people to or join a support group, that might be an issue as well for them if they've got a lot of emotional issues.
And understanding the patient as far as referrals too. Who else can help this patient?
That's right. Yes.
Yeah, I think that's a very important part of what we do.
Which is great. What we have at ATUNE Health Centres here. We're able to recommend certain other practitioners to them that we know would help, whether it's osteo or, you know, whether it's a massage, whether it's physio, some rehab.
Yeah, or
There are
some psychology to adjust those thought patterns that
Yes.
that really impact health.
Yes, definitely. Yeah, that plays a big role. So that's really the beauty of working in a place like this. So from the receptionist, it's helpful for us to know, I guess, just a general idea of what a patient's primary complaint is. That's helpful for us. For example, with oncology, we do, it's a lot more complicated that way, and it's helpful to know the oncologist as well, who the referring practitioners are, if any. We also like to know, we also would like the receptionist to tell them to bring their blood tests with them, the blood test results, bring a list of their medications as well as supplements that they're on, because a lot of the times they forget, and that's really helpful for us because even if they are on other supplements, even if they're natural health ones, we're quite particular about the dosage and the type of supplement. So there are so many different forms of magnesium, for example. We want to know which one they're on and whether that's somehow contributing to some of their symptoms or not, and whether it's really helping them. So in terms of from a practitioner, from a different practitioner who's referring a client to us, we would really appreciate a past medical history, any past diagnoses, medications that they've been on, any improvements that they've seen with the patient themselves, and possibly a bit of their social background, if that would help us as well.
Yeah.